Hi everybody, my name is Dr. Akiba Green. We're talking about gluten sensitivity testing, and really the question is, are all tests made the same? There are two major schools of thought on gluten testing and how to interpret them. On one school of thought, you've got the gluten sensitivity focused researchers, which I'm a part of. The other side, you've got the celiac or villi damage focused specialists. And we differ greatly in our thought process of what tests to run, which really makes it even more difficult for patients to understand their problems. According to most gluten sensitivity researchers, antibodies are conclusive proof of immune reactions to gluten and indicate the need for the gluten-free diet. They do not recommend villi biopsies unless there are other reasons to examine the gut. We use other comprehensive blood test panels to find multiple tissues or function organ damage instead of focusing on only one tissue, the intestinal villi. Our office, again, does fall into that train of thought. Now, gluten consists of many different peptides or molecules. There's gluteomorphins, gluten-related antibodies. They may show up in several different areas of the immune system. IgA, IgG, IgM. These are immunoglobulins in the body, and they can actually be tested in many different ways, including blood, saliva, stool, and in certain cases, even urine. They test as many antibodies as necessary to find the particular antibodies the patient may produce, with much higher rates of positivity than other tests may show. However, in the end, the gluten-sensitive patients do consider even the most complete negative test panel necessarily inconclusive, since there's known peptides and antibodies, which there are no tests for at this time. What that means, it's not that common in practice, but there are pieces of wheat and gluten that cannot be tested, which means even if somebody comes back negative on the best panels in the world, they could still have an issue. Now, gluten sensitivity patients may have autoimmune damage in any of many possible areas, instead of or as well as intestinal villi damage. So we don't automatically use the tissue transglutaminase or TTG test to screen for reactivity to gluten, since it's specific to only one area of damage, the intestinal villi. Dr. Arya Vajani of Cyrix Laboratories believes that elevated tissue transglutaminase is sometimes but not always present in a gluten-related autoimmune reaction. So the researchers show that sometimes you can have tissue damage itself in the villi, many times you don't. Now, the celiac specialists, these are those specialists that are villi damage focused. Only intestinal villi or skin damage is believed to actually confirm through biopsy as the gold standard of autoimmune gluten damage or celiac disease. And really, if you don't show intestinal villi damage or small villus atrophy on a biopsy, then they're going to say you don't have to go gluten-free. If gluten-related antibodies are present and not atrophy or skin damage, the antibodies are completely disregarded as irrelevant or false positive. So literally, you can go off gluten, see a huge improvement in your health, have a biopsy, the biopsy comes back clean, and they're going to say start eating gluten again. And honestly, many, many occasions, including patients that I've seen in my office who have had doctors getting in the middle of their care when we've gotten them gluten-free, have made patients very, very sick. Now, depending on your doctor, it is often hard to find out if you're gluten sensitive. Many researchers and clinicians understand that no one test panel covers all possibilities. Gluten can break down into pieces for which there are no tests at this time. So, patients who wish to leave no stone unturned have to be prepared to run several types of tests, methodically checking all markers, systems, and mediums until they exhaust all known possibilities. There are several known toxic gluten fractions for which no tests, again, are available at this time. I'm able to use multiple different tests and systems to help give my patients the best possible answers when it comes to gluten sensitivity. The problem is that while oftentimes patients feel better on a gluten-free diet, it's not also the rule. Many patients don't have damage from gluten affecting their gut. Instead, it affects their thyroid, their brain, their pancreas, their peripheral nerves, liver, or elsewhere. Testing is essential to help identify the effects of gluten on your immune system. If you're interested in leaving no stone unturned, I encourage you to call and schedule either an in-office consult or distance medicine consult with me to see if we can help you with your chronic health problems. My office number is 704-987-3993. Our website is www.drAkibagreen.com. That's drakibagreen.com.